I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. Joining us today to talk about the unintended consequences of e-cigarette flavor bans and taxes is Dr. Michael Pesko, the J. Rhoads Foster Professor of Economics in the Department of Economics at the University of Missouri. He has published over 70 peer-reviewed papers, including over 20 on e-cigarette policy. He's the director of the Tobacco Online Policy Seminar, an international forum for research on tobacco policy, and he's also a member of the Canadian Scientific Advisory Board on vaping products. Dr. Pesko, thanks for coming back on the show.
Thanks for having me back.
Well, in a quick note to our viewers, this is an extended segment of our discussion with Dr. Pesko, which is already in release, where we discuss in depth his recent research on flavor bans and restrictions with a focus on the United States. Please look for that as we now turn to a Canadian-specific conversation. Dr. Pesko, last month a major paper released titled The Unintended Consequences of Vaping Flavor Restrictions, which you co-authored with Abigail Friedman and Alyssa Crippen from the Yale School of Public Health, along with Alex Lieber from the Lombardi Comprehensive Cancer Center at Georgetown University. It's a multidisciplinary study that merges health policy, oncology, and economics to study vaping flavor restrictions. So, Dr. Pesko, briefly, top line for us the findings of the study.
Well, we look at flavor restrictions in 375 localities, 7 states in Washington, D.C. on e-cigarettes. We find that there are reductions in e-cigarette sales, sharp reductions in e-cigarette sales. So, in flavored sales especially, but then there is a lot of substitution to unflavored e-cigarette sales. And then there are increases in cigarette sales, including for brands disproportionately used by youth.
So the main finding here, which is shocking, is that, as flavor bans come into place, it does lead to more teen smoking.
We're unable to say exactly teen smoking, right? But but brands disproportionately used by young people, including young adults, those brands do increase. So the speculation is, and it's difficult to say, like with sales data, who exactly is buying, right? But our results suggest that this includes increases in smoking among teens.
So the very young people that public health purports to be protecting could very well be picking up smoking as a result of flavor bans.
Yes, that's picking up or continuing to smoke when they otherwise would have quit with an e-cigarette. That is correct.
So as I mentioned, you have direct experience with these issues in Canada. You are a member of the Canadian Scientific Advisory Board on Vaping Products, which is a collaboration between Health Canada and the Canadian Institutes of Health Research. Tell us what you can about working with that group.
Well, I'm very impressed, actually. I think that they are an evidence-based group, at least what the part of it that I see, right? And there could be a disconnect between, my conversations with people and then what actually gets put into practice, right? But I do think that within the group, there are people, they understand that there are negative unintended effects of regulating tobacco products. They understand that e-cigarettes are safer products. My sense sometimes is that they would like to be a little more vocal about some of these things, but there might be some political realities of what they can and can't, do and say, right? But I find, I find them to be knowledgeable, right? Whereas in other contexts, I felt like I was talking to people that didn't understand some of these core issues.
Well, so that's good news to know that the scientific advisors on that board tend to reflect a more positive approach to nicotine vaping products. Let me ask you, is that the kind of experience you've had in Canada elsewhere? Like, what else can you tell us about your work in Canada?
Well, I can't. I haven't done any other real work in Canada. I'm looking at e-cigarette taxes right now, and I have some early work. I'm going to present that at the American Public Health Association conference in Atlanta in November. But yeah, we've, looking at e-cigarette taxes, and the work is pretty preliminary, so I probably shouldn't share on it. But maybe I can just hint that, there's suggestive evidence that kind of aligns with findings from the United States literature, basically. And I'll look forward to sharing that with you guys at some point in the future when the paper is published.
Yeah, that is a big deal. Obviously, we have the federal excise tax. It's almost a year now in place. And I can certainly say there's a lot of people that are, retailers in Canada, and the employees at those retailers have been hurt. And then actual vapors, users have been really taxed.
Federal tax is it's kind of hard to evaluate federal taxes. Just kind of the framework that I talked about in the earlier segment. Generally, it's easier to study province level taxes because then we have a comparison group and we have a pre-post period. Federal taxes, they all get taxed at, the same time. And so we don't have, as easy of a comparison group. I think fortunately, for Canada, I mean, from an evaluation standpoint, at least, right? Whether you say taxes are good or not, but there were some provincial taxes that predated the federal tax, right? And I think that's what the focus is of studying. What can we learn about those taxes? And that should tell us what happened as a result of the federal tax when that came into place as well. And any future provinces that tax or increase their taxes as well. It's important to get some evidence, right? So that we can know expected effects.
Dr. Pesko, as you know, Canadian provinces have caught the flavor ban fever. There are now flavor bans or restrictions in New Brunswick, Nova Scotia, Prince Edward Island, the Northwest Territories, and now the entire province of Quebec. You take Quebec, which is like basically a quarter of the entire vaping market, nicotine vaping market in Canada, and they came down with a crushing, total restriction on flavors. What do you make of all of this?
Well, I mean, I think I would expect the same effects that what we find in the United States, right? Huge reductions in flavored e-cigarette sales, basically down to zero, right? A lot of substitution then towards unflavored e-cigarettes. So those should increase. And then some increases in cigarette sales as well. That's what I would expect. But it would be interesting to do that evaluation. Maybe after my e-cigarette tax paper in Canada, I can tackle that one next. Flavor bans are bad for vape shops, right? And I think, one of the unfortunate things about that, right, is that vape shops that's the last remaining kind of independent competition to the traditional cigarette industry, right? Traditional cigarette industry, those are the bad guys, right? And anybody that competes with the traditional cigarette industry, right? In some ways, those are our friends, right? And the flavor restrictions, right? That's really, it basically makes the vape shop model inoperable, as far as I'm aware. I don't know why people would go into a vape shop if there's not a flavor option. And so, the traditional cigarette industry is very happy about that, right? Because they don't want to have to compete with all those vape shops out there. And that's why I think subtly they're behind some of these efforts to restrict flavors.
I think many of our viewers would wonder, considering that you're positioned with the advisory board, is there some way that the research on flavors can be shared with the Canadian government in a manner in which it might make a difference?
I mean, I can share the paper with people for sure. I mean, I think they are really, the Health Canada folks, they're, very interested in keeping up with research, and I think that they'll be receptive. And honestly, I don't think they'll be that surprised when I share our findings with them. We don't have a lot of power on this advisory board. I mean, they have some questions for us and we give them our opinions on it, right? But we don't really know, how that gets used, and we don't get to just ask them like anything that we want to know and expect them to answer us. Like, we're there at their service, basically, and there's some things that they have questions about, and I think we can answer. So I just don't want people to be misinformed about me having some influence when I I don't really have a lot of influence there outside of just trying to share, good information.
Do you think that part of the picture that's being missed here is that nicotine's been around for 7,000 years, maybe longer, and human beings use it, and it's likely not to stop? So maybe we should be considering about, pushing people into the safer nicotine area of things as opposed to this weird prohibition abstinent attitude.
Yeah, I mean, I'm not sure because, harm reduction, it's actually kind of a popular thing to talk about in the United States right now for everything except tobacco, right? I was shocked. I even saw National Institute on Drug Abuse. They recently funded a study. They had like a safe places for people to use drugs in New York City and Boston, I think, right? And there was some randomized controlled trial regarding, they were going to expand access to these specific sites, and then they were going to track individuals that use the sites for a whole host of different outcomes, related to their health. Basically, does giving people safe injection sites, what impact does it have on them? And NIDA put out a press release just about the fact that they funded the study, right? Which I've never seen them put out a press release about funding a study. Sometimes they publicize the results of the study, but they must have felt like that was, that was really playing to the times, right? That they could put out a press release just saying, "Hey, look how progressive we are," or whatever, right? On top of the times we are, in that. We funded this, right? So harm reduction seems popular, but then it can't be applied to, nicotine. And I just wonder if maybe things kind of go in cycles, right? Because, 30 years ago, right? I mean, I think there was just a lot of focus on marijuana prohibition and trying to stamp out marijuana use. And then at some point, people just kind of realized we can't really do that, right? People use it, right? Because people demand it, right? And if people demand something, there's going to be a black market that supplies it. And so why not, if that's happening, then why not just bring the market above ground and regulate it? And that's where we are basically in the United States right now, right? With most states having, some form of recreational or medical marijuana law, right? And all kinds of efforts to increase it, including talking about flavors for a second. California even allows flavored marijuana, right? And they don't allow flavored tobacco, right? So it's interesting, right? And so I wonder if we need to just kind of go through this cycle, right, where people are just really trying to stamp out nicotine product use, right? And maybe they'll just need to see it's not going to go anywhere, right? At least that's my suspicion, because people like nicotine. It's there's benefits of it, and that's why people use it, right? Cognitive improvement, more alertness. Those are just some of the some of the benefits. Obviously, it's addictive, and then all the other things in the nicotine, in the tobacco product as well, cause all kinds of cancers and whatnot that lead to tobacco-related disease and death. But the nicotine itself isn't necessarily a problem, right? And that's why the FDA has approved nicotine gum, et cetera. So yeah, I wonder. I wish I was more optimistic, but I just wonder if we need to just kind of go through this, period, and maybe there will be 10, 15 years from now, there will be kind of more more sane discussions will transpire.